Welcome back from that commercial break. Of course, this is HealthPod, Family TV. Thank you. You is still following us. Plus you, our social media audience, you who are following us from Facebook and YouTube. Thank you so much. Doctor, we are looking at birth preparedness. Maybe to you who has just joined us, we are looking at birth preparedness. And Doctor was taking us through what you need to prepare. What you need to be with or what you need to prepare for during this process of birth preparedness, because you told us it is a process. So Doctor, we had talked about a few elements under birth preparedness. What else should we consider under birth preparedness?
Thank you so much, Eddie. As I've told you, birth preparedness shouldn't be an accident, shouldn't come as an accident. Like I always see some young men, when a woman is in labor, they run to the neighbors. Oh, I have a problem, I have a problem. It shouldn't be a problem. When you are receiving a newborn baby, this newborn baby should not be a problem. So you need to prepare in time. And these are the things I'm continuing to explain. You need to prepare, like for the case of women, you need to know whom you are going to live at home. Why do we prepare people to live at home? You may be having other children at home, and you are going to leave these children to go to deliver. So around that time, if the woman is not prepared, some of them refuse to go to the health facility because they are worried of their homes. They didn't prepare. But if you prepare in time, you just inform this person, it is time for me to go to give birth. Please, as I had told you, you can keep my home. Then the other thing, you also need to prepare the person to accompany you. There are times when you go to the facility and they will need an attendant. And if you didn't prepare this person, then you'll find yourself going alone and getting stranded there.
Maybe, Doctor, why some ladies don't want actually to get these attendants, that especially in government facilities, they restrict these attendants. Yeah, so the attendants suffer a lot. That is why I think they don't want to bother them anymore. They don't want to bother anybody accompanying them. It is better someone suffers alone.
It's not that they restrict. They may restrict maybe 2, 3, 4, but at least in most government facilities I know, at least they allow one attendant, because this one attendant most times helps them. You know, we have a shortage of health workers in the facility. So sometimes the patient may want to go to bathe, and they need somebody to support them. Instead of a nurse accompanying the patient, at least the attendant can be there to support this patient to go to bathe. So it's not that they restrict so much, but there's some allowance of at least one attendant per patient. And as I had told you, you need to prepare, you need to know where you are going to deliver from. That has been a problem for most mothers, especially when they've not prepared. It reaches a time when they're in labor, then there is first consult, you know. They first consult the mother-in-law, and then the mother-in-law may not have the rightful decision. They may tell them, you deliver from here, because we don't have money. But if you prepared early enough and you've been going to that facility for antenatal care, the moment you get the labor pains, it will be easy for you to move from home to that facility to deliver. And then the other thing, you also need to prepare for family planning. Yes?
Before you give birth?
Yes. Before you give birth, you need to know how are you going to take care of this baby without getting any other interference of another baby when you are still taking care of the newborn baby. Because after 6 weeks, a lady can be able to conceive another baby. Now it means you are getting pregnant when this baby still needs a lot of your time. and the baby's health will be compromised. Even your health and the one who is not yet born, their health, the three people, their health will be compromised. So you need to think about family planning before you give birth to a baby. Why should pregnant women prepare for birth?
Maybe, doctor, before we go to that,
Yes.
I would also want us to now talk about the role of men or husbands in all this, because you only told us about men accompanying their women or their wives when they're going for tests. Yes. What else should husbands do? Because I believe this is now a joint effort, yes. Husband and wife. Let us now talk about the role of husbands.
Yes, I think you brought in a very, very important issue of the role of a husband. You know, when this baby is being conceived, there are two people, and each one has a role to play. So when the mother is pregnant, the husband has to be there to support this mother to go through the 9 months by accompanying her for antenatal care, by going for HIV tests, supporting her emotionally, morally, financially, and actually, in our settings, mostly it is the husbands who control the finances. Yeah. So if the husband is not involved, it means this woman will have challenges of accessing finances. And once a woman cannot access finances, it is going to compromise a lot of things. Access to care will be a problem. So this husband has to be involved in every stage, right from pregnancy throughout, you know. So it's not just accompanying, going for HIV test, but throughout the entire process, buying the mother kit, the baby's clothes, and everything that needs finances. This husband has to be available. Yes.
Okay, so doctor, you were taking us through why a woman needs to prepare.
Yes.
Yeah. Why? Why is birth preparedness important anyway?
I need everybody to understand that the assistant got from the skilled birth attendants. I'm talking about the skilled birth attendants who are trained. Those are the health workers, the doctors, the midwives, the nurses. Is one of the strategies.
We have a problem, doctor.
Yes.
You talked about skilled,
yes,
health workers.
Yes.
Now, we have these village, I think they call them Mukalazi, okay? Those village midwives who are not professional midwives.
Yes.
But they are skilled. And actually, the reason as to why women go to them, they believe they are skilled. What threat is engaged in women referring to those skilled village health practitioners who are not professional in what they're doing?
I think we should differentiate between being skilled and being experienced. They are experienced in conducting deliveries, but they are not skilled because they are not trained into that. So them having conducted 10, 20, 30 deliveries, that does not make them skilled. But we are looking at somebody who went through the training, who understands each and everything going around this mother and the baby. So these are the health workers I'm talking about. And it has been proved that these people being involved in delivery is one of the strategies aimed at reducing maternal mortality, maternal morbidity, and mortality, especially in our setting, in low-income countries like Uganda. So we are looking at reducing mortality. We are looking at reducing maternal mortality. We are looking at reducing newborn mortality. So that's why we encourage all mothers and their families, when it comes to, when they start labor pains, they should go to the health facility and be attended to by the skilled birth attendants. And why are we looking at birth preparedness and then the skilled birth attendants. We want to reflect on the causes of mortality. The causes of mortality, which most of them, causes of mortality and morbidity, most of them are preventable, okay?
What are some of these causes, maybe?
We are looking at bleeding. It can be prevented. We are looking at sepsis. It can be infections. Yes, they can be prevented. We are looking at hypertensive disorders. You know, they can be prevented. But all these causes can be prevented if care is sought in time. So that's when we look at the 3 delays, you know, the 3 delays. There are 3 delays that has contributed a lot to mortality, to death. And this...
So maybe, doctor, before we go to the 3 delays,
yes,
you are talking about bleeding. And now we want to see what causes this bleeding. Because I believe bleeding might be normal to any lady or any woman giving birth. But then, when do we know that this bleeding is now a risk?
Yes. Yeah, when women are giving birth, at least there's some blood which comes out. But when it goes beyond, when it reaches a certain level, from 500 mils onwards, it becomes risky. You just know this woman is likely to bleed to death. So now bleeding has different causes, okay, which can only be identified by a skilled birth attendant and can only be addressed from a health facility where there are skilled birth attendants. You talked of the village birth attendants. Yes. They may not be able to address such challenge problems when a woman is with them. So that's why we say when it is time for a woman to deliver, they should seek a skilled birth attendant. Yes.
So you also talked about the infections.
Yes.
What are some of the risks, or what are some of the causes of these infections for a pregnant mother?
They are different infections, and they have different causes. Some of them, like malaria, is an infection. Yes, and it can cause death. It can cause death. We can only identify it or diagnose it from the health facility. So you cannot say that you'll go to a traditional birth attendant and they'll be able to diagnose that this woman has malaria and this is what is causing, because the symptoms may be similar to another infection.
There is also another tendency of people practicing self-medication.
Exactly.
When they feel some fever, they go to a pharmacy, exactly, buy some medicines, and then...
Yeah. So if you've not gone to a skilled to a health facility where there are skilled health workers, you do self-medication, you may be treating something with a drug, with the wrong drug. Yes. And then we are talking about birth preparedness. At the traditional birth attendant or those village birth attendants, the chances of getting infection are high because, first of all, the place where they're delivering from is dirty. It's not as clean, it's not as hygienic as a health facility. They are encouraging women not to prepare because for them they can recycle, they can use the same bed, the same polythene sheet for 10 women and it is okay. And then these women may say, I would rather go to this one who will not ask for me the polythene sheet than going to a facility where they will ask for a polythene sheet. So if the woman didn't prepare, they are likely to go to those traditional birth attendants. because they have theirs. One leaves, they clean, sometimes they don't even clean, another one comes on. So the infection, the chances of getting infection from that polythene sheet are so high, and from there somebody they can die out of infection.
Okay.
Yes.
So, Doctor, I beg we end at this, and then next time we shall talk about the 3 delays. But of course, before we end the program, I want you to advise mothers concerning what we have talked about today. Birth preparedness, before we go to now the 3 delays, because we'll look at the 3 delays and in the next program.
Thank you so much, Eddie. Before I end, I just want to thank the viewers. I want to emphasize a number of things, just as I had already told you, that birth preparedness is a process. So start preparing birth as early as possible. Immediately you identify that you are pregnant, start preparing for birth. And because we know that if you don't prepare for birth, you are reducing of your chances of accessing care at a health facility, and then you are increasing the chances of death because of something which is small, which you can avoid by just preparing for it. So thank you so much.
Okay. Thank you so much, Dr. Sarah. That was Dr. Sarah taking us through birth preparedness. But of course, we shall have Dr. Sarah again in the next program, taking us through another topic, and that is the 3 delays. And these are so important, so you shouldn't miss Health Pot. Every Friday at 7 p.m. we are right there in your living room. I remain Edrine Austin Mukalazi, but I've worked with Tony Santo on social media. I've worked with Bantam in transmission, and producer Jonah was right there. Thank you so much. Good night and a happy weekend.